What if the future of healthcare wasn't just about treating disease, but about knowing your fears, your habits, your whole story before you even walk through the hospital door? AdventHealth, one of the largest faith-based health systems in the United States with more than 50 hospitals and hundreds of care sites across 9 states, has just announced a significant partnership with OpenAI, the artificial intelligence company behind ChatGPT and some of the most powerful language models ever built. And this isn't a superficial technology upgrade. This is a deliberate, philosophically grounded effort to reimagine what healthcare can actually be. AdventHealth has long operated under a mission of whole-person care, a concept rooted in their Seventh-day Adventist heritage that treats patients not merely as collections of symptoms, but as complete human beings with physical, mental, emotional, and spiritual needs. The question they're now asking is a bold one: can artificial intelligence help deliver on that promise at scale? The partnership with OpenAI is designed to embed AI capabilities deeply into AdventHealth's clinical and operational workflows. We're talking about tools that can help clinicians synthesize vast amounts of patient data more quickly, reduce the crushing administrative burden that has driven so many healthcare workers toward burnout, and ultimately free up more time for the human connections that define meaningful care. When a nurse spends less time on documentation and more time sitting with a frightened patient, that is not a small thing. That is the entire point. What makes this collaboration particularly noteworthy is the intentionality behind it. AdventHealth isn't simply licensing a product and deploying it across their system. They are working with OpenAI to build solutions that are specifically aligned with their values around compassion, dignity, and holistic healing. In a healthcare landscape where AI adoption is often driven by cost-cutting pressures rather than patient-centered philosophy, that distinction matters enormously. There are also real, substantive questions being addressed here about safety and trust. Healthcare is one of the highest-stakes environments imaginable for AI deployment. A wrong answer from a chatbot recommending a restaurant is an inconvenience. A wrong answer in a clinical setting can cost a life. AdventHealth and OpenAI are both aware of this weight, and the partnership appears structured around careful, responsible implementation rather than a rushed rollout chasing headlines. Consider also the workforce dimension. There is deep anxiety across the healthcare industry about what AI means for the people who work within it. AdventHealth employs tens of thousands of caregivers, and the framing of this partnership is notably not about replacement but about augmentation, giving skilled professionals better tools so their expertise can shine more brightly, not making them obsolete. Whether that promise holds as the technology matures will be one of the most important stories to watch. The timing of this announcement also speaks to a broader inflection point in American healthcare. The system is strained by staffing shortages, by rising costs, by an aging population with increasingly complex needs. Technology alone cannot fix structural problems that run this deep. But intelligently deployed AI, built around a genuine commitment to human dignity rather than pure efficiency metrics, could represent something genuinely transformative. AdventHealth is essentially placing a very public bet that the values which have guided their mission for decades are compatible with and perhaps even enhanced by the most sophisticated AI tools in existence today. OpenAI, for its part, gains a deeply credible healthcare partner willing to do the hard, careful work of responsible deployment in an extraordinarily sensitive domain. And perhaps the most profound question this partnership raises isn't about technology at all. It's about what we believe healthcare is fundamentally for and whether we have the courage, the creativity, and the compassion to build systems worthy of that belief.